Many states today are looking at the need for establishing a state-based health insurance exchange. This presentation will look at the need and potential for state-based health insurance exchanges using a new approach to strategic planning, to tactical planning, to trying to figure out what is right and what was wrong and how we might change the situation. It's a powerful approach called scenario planning. I hope you'll enjoy it. We'll start off by looking at something called the Ralph-Stacey diagram. This is establishing the need for scenario planning. If we have a great deal of uncertainty and disagreement over a situation, we'll find ourselves in different environments. If we have a relatively low level of uncertainty and disagreement, we have something that would be referred to as stability. However, as the uncertainty and disagreement increase, we have complexity. There are different rules and regulations, there's legal compliance issues, litigation issues, and as we get to a great height of disagreement and a great deal of uncertainty in the marketplace, we have a chaotic marketplace. Many people feel that today in the healthcare arena, especially with the national healthcare reform under challenge on a constitutional basis and the political environment being so dynamic, that we are in fact in a chaotic situation. So scenario planning will try to help us change this great deal of uncertainty and disagreement from a problem into a strength. Let's take a look at the two biggest areas of uncertainty and disagreement. The legal challenge, whether it's constitutional, whether it's unconstitutional. The political, whether the control is with alignment A or alignment B. What happens in terms of whether we're going to expand it with a political alignment or whether we'll repeal it with a political alignment. Let's take a look at various scenarios. First of all, again, this constitutional versus unconstitutional challenge, we'll make that the vertical axis. Now, on that axis, we could have an individual mandate ruled as unconstitutional or the entire PPACA legislation ruled unconstitutional. On the political side, on the horizontal, we'll look at political alignment A, which will be a political alignment that would want to expand, create more enabling legislation and regulation. Political alignment B, however, would be for dismantling or repealing the legislation. That's the great debate we have in the country today. And in each area of those political alignments, there could be some control or there could be total control. The total control definition would be along the lines of the presidency, a filibuster-proof Senate, and a House of Representatives control. Some control would be either the presidency or the financial controlling entity, which would be the House of Representatives. And that could be as the political alignment moves from one to the other. Let's take a look at what I'll call scenario one, constitutional plus. In this case, we have the PPACA, or the American Health Benefit Exchange, and the SHOP Exchange, which is the individual and small group. This is where many states are looking at establishing a health insurance exchange. I'll identify this as an HIX, and these would be federal and or state or developed exchanges. This is what most states are actually working on. However, if total control goes to political alignment A, which is interested in moving even more federal control, we could have something that could be called the son of PPACA, which would be expanded coverages of what's already in the PPACA legislation, additional subsidies, more benefits, and potentially price controls. In this case, if a state established a state exchange, it would be more likely that under the son of PPACA, there would be more federally controlled guidelines and restrictions on the exchanges. There are many that feel today that there's very little state flexibility allowed even under the current PPACA when it's ruled and regulated by the federal government. So the idea that a state could have a lot of flexibility probably isn't realistic, and especially if total control was to go to a political alignment A, feeling is that they would go even further than what we have today, and in fact they could go to a single payer system where the exchanges would no longer be needed, because a single payer system, although it can be designed in many different ways, typically would make payments directly to the providers and cut out the insurance. Now let's look at scenario two, which I'll constitutional minus. In this scenario, the bill is ruled as constitutional, and there is some control by those who would, in political alignment A, want to dismantle or freeze the legislation, even if it was constitutional. Here you probably have the President and the House of Representatives in particular in control with political alignment B. Here we probably have federal gridlock, there'd be state waivers, there'd be regulatory freezes, and the subsidies for the exchanges, which are worth about $450 billion, probably would be frozen or eliminated, making the exchanges somewhat irrelevant. So there'd be a freeze on the exchanges. If there was total control on political alignment B, there we would see or repeal the legislation so that the exchanges would no longer be needed. However, in both scenarios, there is potential for a state-based exchange regardless of what happens at the federal level, much like Massachusetts, Utah, and maybe what some other states are beginning to plan for. But certainly there's also the developing opportunity out there for the private insurance information marketplaces that will provide complete transparency on insurance, on coverages, on benefit design, on pricing, on hospitals, on providers, and insurance agents that sell the products, and much, much more to give total and complete information to consumers out there. It's a area that the federal debate has actually highlighted a need for a more efficient delivery system and a single source of entry for people who want insurance either in the individual or small group marketplaces. In both of these scenarios, we think that the state is going to be under control, that the federal government will either again be frozen or the PPACA goes away, even if it's constitutional, it doesn't have the political support, so it's repealed, in which case the control for healthcare reform reverts back to states. So in this case, the power goes to the states, and when it does, they're going to need an alternative health reform plan. Most states don't have the best insurance laws in place or healthcare reforms prior to the PPACA, and PPACA did generate a number of good ideas that would be worthwhile for any state to adopt, even if it's just for that state when their control shifts back to the states. So the recommendation is that even though an exchange may not be needed, the state does need to make some health reforms so that better products can be offered to the citizens of those states. Let's take a look at scenario 3, the unconstitutional, partial, or complete. In this case, the unconstitutional nature of the PPACA bill may be just that the individual mandate is ruled unconstitutional, or the entire PPACA legislation can be ruled unconstitutional. In the first case, if just the individual mandate is ruled unconstitutional, there's likely to be no exchanges subsidies that are established. While only the individual mandate is unconstitutional, if the political control is for those in political alignment B, it is likely that they would remove the subsidies, which are worth about $450 billion, and would create a lot of market chaos because the exchanges might be set up, but they would be basically frozen in place because the subsidies would create a disadvantageous environment, or at least it wouldn't be encouraging people to sign up for the exchange, so there'd be little value involved with going to an exchange versus buying products outside the exchange. If the entire PPACA bill is ruled unconstitutional, we'll then have a split in the political alignment. There's some control on political alignment B, but not enough to have total control. So there's a possibility we could get a do-over, but still the health insurance exchanges would no longer be needed. If the individual mandate is unconstitutional and there is total control by political alignment B, they would be looking at a repeal of the legislation, so again the exchanges would no longer be needed. If the entire PPACA is unconstitutional, again it's obvious then that political alignment B in total control and it being unconstitutional, any state-based exchange really would no longer be needed. However, in both cases, state-based exchange could be established. Again, like Massachusetts or Utah, states would be free to establish state-based exchange to have their citizens have a single place of entry to buy insurance. But private insurance information marketplaces are developing out there that could be much more efficient and much broader, not just providing healthcare information, but life, disability, long-term care, and other insurance products. It'd be unlikely that a state without the federal mandate or a state mandate could effectively market against a private insurance company when the state doesn't have that kind of monopoly power. The ability to provide a self-sustaining business model with a state-based exchange would be very challenging. In each of these cases, then, we see that the states actually will have control, and there is a need then for states to develop an alternative plan, because the power in these scenarios has gone back to the states as the classic petri dishes of experimentation to develop what works and what doesn't work, so that those ideas can be shared to other states. So in all these cases here, we really will be under control. Let's look at the fourth scenario. That is, if the individual mandate is ruled unconstitutional, but political alignment A does have some control, it's entirely possible that the individual mandate going away means that you cannot penalize people. So if the presidency is under some control for political alignment A, it's possible they could establish what some would call a non-penalty federal health insurance exchange, or HIX, but add a pre-existing condition under an agreement with the insurance companies to allow for some underwriting and some use of pre-existing conditions to offset the fact that it is not an individual mandate. That's a real scenario and a possibility. Now, it may not be technically legal for the legislation to be interpreted that way, and there certainly could be some court challenges, but so much power has been granted under PPACA to the Secretary of HHS that it's entirely possible that there could be interpretations to allow for some level of pre-existing condition without going through the legislative process. If PPACA is ruled unconstitutional and political alignment A does have some political control, again, we have a split government and it's possible to do a do-over again, but the federal HIX or PPACA health insurance exchanges would no longer be needed at that point. But again, a state-based, without the federal legislation, or private insurance information marketplace would have a place in need for selling insurance and getting people to the right coverages. If there's total control on political alignment A and the bill is ruled unconstitutional, then you could just simply change the penalty to a tax. We do have a constitutional amendment that allows the federal government to tax individuals, and they could tax people for not having insurance. That would more likely stand up to a political and legal challenge. But if that happens, the feds will take more control over the PPACA HIX. And in fact, they could again establish a single payer system if they have total control, in which case the HIX are no longer needed. In the first two scenarios we mentioned, again, the power is likely to go back to the states, and the states will need to have an alternative plan. So when you put all this together, you can see why this chart wasn't presented first. It gets a little bit complicated, but in all these different areas here, the states will take control, and you'll either have a freeze on health insurance exchanges established under PPACA, or those exchanges, the HIX as you will, are no longer needed under most of the scenarios. And in fact, it could be that while the HIX could continue to exist, the state flexibility or the state control is pretty much minimized by the feds taking over more control. But in all these areas, again, that we mentioned, where the states would have some control, it is possible for states to establish a state-based exchange that would be run by the states without the federal legislation, or with the federal legislation, but with it being frozen, there's still potential for states to do what they want. Under the 10th Amendment, states can constitutionally establish an exchange, although there are some who would debate that. But certainly in all these cases, a private insurance information marketplace has its potential, and a lot of companies out there are using new technologies, developing new extensive products and services for clients that they're already delivering these services to, because their client base, their business model is based around services to brokers, to hospitals, to physicians, so there's already a base there. Now, how do you know with this confusion, as we look forward to this future in 2012 developing before our eyes, the great debate that's going to go on, how do you know which way to look? Well, which way are we moving? Look at the court decisions, read the court decisions, the circuit court decisions, the appellate court decisions, and ultimately watch the Supreme Court as it's making its decisions, and probably will take up this case in 2012 and make a ruling by June of 2012. If you're looking on a horizontal, which way are we moving? Well, there you ought to be able to look at the presidential election, U.S. House of Representatives, and the Senate. Look at the polling, look at the potential, do the number counting, follow the talking heads on the cable news to sort of see where we're going, and you make your own decisions. But with these two approaches, you can sort of see which direction we might be moving. So what does the scenario planning tell us? Well, it tells us three things. One, that there's a substantial probability that state-based PPACA exchanges, which we've identified as HIXs or HICs, state-based exchanges will undergo legal and regulatory revisions that could effectively halt implementation, eliminate them, or transfer more control to the federal agencies. Second, that existing state insurance laws and regulations need reforms to improve the private market safety net, increase access to coverage, improve the health of citizens, make insurance more affordable, and lower the number of uninsureds. In other words, the states need an alternative health reform plan, so when the control goes back to the states, the state laws will be in effect, and most of those need substantial changes. And third and final, states should form an advisory committee to vet state-specific ideas and develop multi-stakeholder bipartisan input that proposes insurance and health reform for the time when those health reform controls move back to the states. I hope this is helpful in your thinking about health insurance exchanges as well as many other items. Use the scenario planning. It's a great tool to identify all the different areas. You don't have to guess or estimate or use your own opinion as to which scenario is most probable. You can look at all of them and see how the dynamics would change as the world develops. And so you're not caught flat-footed. You're not caught without some idea of what is going to happen and how you would respond. So as a business leader, as a governor of a state, of a manager, scenario planning can be a very powerful tool to take that great level of uncertainty about what's going on and turn it into a planning tool that gives you the strength and the knowledge and comfort of knowing what you can do regardless of what scenario develops.